Happy summer, y'all. It's July, and I'm sure you're enjoying some barbecues, holidays, and hopefully some R&R. Amid the fun, though, I think we can all agree that we're feeling the heat. It seems like we're hitting record high temperatures every week, and we know that staying inside in cool, safe spaces is growing more important with our health during these hot summers. So, as the impacts of climate change and our health seem more and more intertwined, have you ever wondered how we can address the two at their crossroads? The Biden administration decided that it would take a faithful step to do so when it formed the Office of Climate Change and Health Equity, or OCCHE, within the Department of Health and Human Services on August 31st, 2021. OCCHE has been rallying departments within HHS, other partners across the federal government, and the health sector itself to improve climate-related health outcomes for our communities, adopt sustainable energy, and reduce the very emissions that impact our health. What's key here is the role of partnerships. It'll take the health, energy, transportation, housing sectors, and more to ensure a healthier planet for us and for our environment. OCCHE Director Dr. Balbus is all about building partnerships, and so is George Mason University's Center for Climate Change Communication Director Dr. Ed Maibach. Doctors Balbus and Maibach actually go way back in studying and collaborating on action to improve climate and health outcomes. This is Empathy Affect, the Forsmarsh Media podcast that explores the human side of government. I'm Melissa Harris-Sazinski, and get ready to grab a nice cool drink and spot in the shade with me as we chat with the doctors about their research and efforts to help us stay healthy while taking action against climate change. Dr. Balbus, welcome to Empathy Affect. How are you?
I'm doing great. Thanks, Melissa.
And Dr. Maibach, it's also wonderful to have you.
Thank you, Melissa. Great to be with you.
And thank you both so much for joining us on the show today to talk about the intersection of climate action and health. There are a few people who I can think of to have this great conversation with. So would each of you like to start by introducing your respective organizations? Dr. Balbus with OCCHE and Dr. Maibach with the Mason 4C, and how is each contributing to action against climate change?
Sure. I'll go first since you mentioned it first. Our Office of Climate Change and Health Equity is about 3 years old. It was created in the Department of Health and Human Services by an executive order from President Biden with the express mission of protecting the health of people in the United States, especially those who are most vulnerable. And our office has also taken on the mission of working all across HHS and, in fact, across the entire health sector of the United States to help transform it towards lower pollution, lower greenhouse gas emissions, and greater resilience to climate change.
Yeah, I'll jump in and say that the George Mason University Center for Climate Change Communication, that's the group that I run, it's a think and do tank. Here in Washington, we've got a lot of think tanks, but we're proud of the fact that we're a little bit different, above and beyond the fact that we're located in a university. So the think part of our work is we do research to understand what the public knows about climate change, and in the case of our conversation today, what they understand about climate change as a human health issue. We also do research on who they trust, what information would have value to them, essentially what kinds of messages would have value to them in helping better understand the realities of climate change, the realities of climate change as a human health issue. The do part of our work is that when we've identified through our research insights that appear actionable, we test them. So one of the things that we learned relatively early on is that when you talk about climate change as a human health issue, as opposed to, say, an environmental issue or an economic issue or any of the other extreme weather issue, it's really helpful to people. It's information that most of them hadn't heard previously, hadn't considered, and reveals a personally relevant side to climate change that most people hadn't considered. So we've built on that insight by creating a program we call the Medical Society Consortium on Climate and Health. We currently have 57 medical societies who are members of that consortium, and we work hand in glove with them them to try to educate their members, their health professional members, and through their members to educate the public and policymakers about the human health relevance of climate change.
You may be wondering, okay, Melissa, Dr. Balbus is in government and Dr. Maibach's in academia. Yes, they're both in the fields of climate and health, but where has their work together overlapped? Well, turn back the clocks to around 2007, 2008. This time was a watershed moment for climate change. The Intergovernmental Panel on Climate Change released a report saying for the first time that climate change was human-caused.
The report provides overwhelming evidence that global warming is real and that human activity is the driving force.
On top of that, the World Health Organization said for the first time that climate change was going to be the biggest threat to global health in the 21st century. At this time, too, Dr. Balbus was with the Environmental Defense Fund, and Dr. Maibach was just coming to George Mason to launch the Mason 4C. The two actually collaborated on a study with the National Association of City and County Health Officers, NACCHO, to survey local public health department directors to assess their current understanding of climate change as a relevant public health issue. Turns out that level of understanding wasn't that great, but the impact of climate change was already being felt around their communities.
Back in 2008, what we found was a very, very low level of self-professed awareness, competency, and knowledge. It was, I think, less than 20% of people in public health fields felt like they knew what they wanted to know about climate change. Even at that time, and I think the numbers will have gone up significantly since 2008, the majority felt that climate change was a very important issue. A very large proportion, even back in 2008, I can't remember if it was more than half or less than half, but it was a high proportion, felt like they were actually seeing impacts of climate change in their jurisdiction at that time. And many of them felt that they would be seeing, but their feeling that they knew what to do, that they had been given the information, that they were ready, was very, very low.
Wow.
And that was a long time ago.
Yeah.
And we actually, some other colleagues and I replicated that study. It's using a slightly different survey methodology about 4 years later. And we found more or less the same thing: high levels of concern, low levels of preparedness. But what we also saw in that replication was the beginnings of the polarization between health department directors who were in more liberal jurisdictions versus those who are in more conservative jurisdictions. So this really strong sense of an America moving in opposite directions on the issue of climate change, depending on if they were in a blue state, a blue county, or a red state, a red county, we started to see that encroach into the public health sector, which in my opinion was very much not a helpful thing. Public health responses should be based on science and evidence, not based on sort of partisan politics. But in fact, we started to see that influencing the way local public health department directors were thinking.
Indeed. And, now it's the summer. Obviously, when it's really hot, people feel that at a physical level. But just at the bigger picture, thinking back about where you were in 2008 and where you are now, how are you seeing climate change directly impacting public health? And, if you had to pick a couple things, I know it's probably hard to, what are some of the most pressing health issues related to climate change that you're both focusing on at the moment?
So, I think it's really important just to start answering that question by saying, rather than singling out one of the myriad of health impacts of climate change, the most important thing right now is, with 2023 being by far the warmest year on record, 2024 continuing to warm, it's important to recognize that there are many, many health impacts, and that those health impacts are going to get worse, and that most important thing we can do is to stop climate change and slow it, and slow the progression of climate change, because it's going to affect all kinds of health impacts. But that said, the things that are most visible are the things that we feel in the short term. Last summer at this time, everybody in the East Coast was waking up to red skies, and had this prolonged influx of terrible wildfire smoke from eastern Canada. That's something that happens in the United States every year. Just people in the East don't usually see it. It's usually in the West. And that's one salient, visible exposure that people feel and they taste and they see that has, many different health impacts, from increased emergency room visits from asthma, like we saw in New York City, to increased mortality from the particulate matter in that smoke. We've seen a big jump up in heat-related mortality, and everybody's feeling that. And of course, we're seeing unprecedented levels of heat in different parts of the country this year, earlier than we had seen it before. An unusual heat wave in the Northeast that we hadn't really seen before. And the number of heat-related deaths has jumped up, almost threefold since the last decade. So those are salient. You can see them, you can feel them. The third thing I would put on the list is the mental health impacts, because the more people see and feel and read and experience, or have loved ones experience, these extreme weather events, right now our minds and hearts are with the people in the southern and eastern Caribbean as an unprecedented hurricane barrels through there. It's really hard on people's, psychological well-being. This is very scary, and there are multiple surveys showing a very high rate of anxiety and depression in especially in younger adults and children. So I think it's something that has relatively recent come to the fore, but I think it's very clear it's happening now. It's very clear it's contributing to a larger epidemic that we're experiencing of anxiety and depression and substance use, et cetera, in adolescents and young adults. And it's something that we're really trying to focus on.
There's one other element that is very different today than 15 years ago when we did that research. And that is, the epidemiologists, our epidemiologic colleagues, have learned more and more about the impacts of exposure to air pollution. And, one of the health impacts of climate change is when we get extreme heat, we tend to have more dangerous air quality. And the epidemiology over the past 15 years has really revealed how incredibly pernicious that is, how neurotoxic exposure to air pollution is, especially for young brains, children, and babies in utero, but also for older brains, people in the final stages of their lives. So the neurotoxic effects, the neurodevelopmental effects for young children include increasing risk of ADHD, of autism, of learning disorders of a variety of types. The neurodegenerative effects on older adults include Parkinson's, dementia, Alzheimer's. These are health impacts of exposure to air pollution that really weren't understood 15 years ago. And now that we do understand them, now that the research has revealed these hidden impacts, it's certainly, for me at least, it shows that we really have to focus not only on the health impacts of climate change, but on the health impacts of fossil fuels more fundamentally, because burning of fossil fuels is the primary cause of climate change, but it is also a direct cause of all sorts of morbidity and mortality. In fact, the numbers aren't really tallied by anyone yet, but I'm quite convinced that once the numbers are tallied, the fossil fuel economy, burning of fossil fuels to run our economy, will be demonstrated to be the leading preventable cause of morbidity and mortality in this country and worldwide.
Absolutely. And what I'm hearing from both of you, is that this is really a cross-sectoral issue. It's energy, it's health, it's our community building and resilience. It's really a cross-sector collaboration. And both of your organizations are well positioned to establish these collective efforts. So I was wondering if you could each share some of the best practices that OCCHE and the Mason 4C have each adopted to address climate change or coordinate government responses, in OCCHE's case, to climate-related impacts. And Where are you seeing some of the most meaningful partnerships making an impact against climate change and for health outcomes?
Let me start by going back to how our office works and what it is we do, because the most important sector that we have to really mobilize is actually the health sector, which has been relatively late to the game. Ed and I were talking to public health departments. Had we talked to hospitals and doctors and people in the healthcare delivery side, awareness would have been lower, and I think concern probably would have been lower even back then. Concern's high now, but the health sector is, roughly 20% of our total economy. In most communities in rural America, it's the biggest employer. It's one of the bigger polluters when you look at it as a sector. In the United States, it contributes about 8.5% of the greenhouse gases the United States puts out, which puts it above, the airline industry, which a lot of people are surprised by. Globally, it's about 5%. So a lot of what we're doing is getting into the nitty-gritty details of health policy to use existing opportunities and leverage to harness some of the power of the health sector. And that includes things like Medicaid waivers that are available to help low-income families be able to, and low-income patients be able to buy air conditioners or air filters to address heat or air conditioning. It's about trying to direct the resources available through the Inflation Reduction Act, which is a game changer for the health sector as well as the rest of the economy, to be able to, use those funds to install resilient clean energy systems with microgrids and battery backups, for example, for community health centers, so that the safety net health system in this country doesn't go down when every time the grid goes down. These are really powerful, really important things that have never been done, in the United States at scale. And our office is trying to get that scale up. So that's just the health sector. I'll just say real briefly, we also co-chair the National Integrated Heat Health Information System and the HEAT working group across the government, which is a really great example of collaboration between that HUD, the housing side, energy, the weatherization and energy support side. FEMA is a co-chair now, and FEMA is putting tremendous amounts of resources, money and informational resources to building community resilience and addressing heat. The best practice is really just creating the platforms within the federal government to have high awareness of the different programs that can all come together. The federal government is really trying to address, a serious problem we hear from communities all the time, which is there are, as many doors as there are agencies, and a single community cannot open, 12, 15, 17 doors to try to figure out how they can get the funding for the things they need. Really trying to have a one point of entry, really having to have coordination, really trying to lower the bar for the kind of technical pre-work communities have to do in order to be able to qualify for funding. Things like what FEMA's just done with a new guidance simplifying benefit cost analysis. That's really, I would say, that the progress the Biden administration has made in these last few years on streamlining and making it easier for communities to access funds from all the agencies is definitely a best practice.
Absolutely.
Yeah. As John was saying, it's so important for the health sector to decarbonize because it is a significant contributor to carbon pollution. And it is so important for the health sector to become more resilient to the impacts of climate change, because we need our health sector to be, our health systems to be at peak efficiency always, but we especially need to keep them resilient to the impacts of climate change, because during climate impacts is when we most need to have a high-performing health system. And so if its capabilities are eroded during times of climate impacts, it's like a double tragedy, a convergence of bad events. But the work that I do is more focused on another opportunity, and I call it the necessary and unique role that health professionals and the health professions can play in helping all of society rise to these challenges and these opportunities. I say it's a necessary role for the health professions to play because, as we've been talking about, the health impacts of climate change are profound, and the health impacts of the fossil fuel economy are profound. Our research at my center has shown that health professionals have a unique level of trust among Americans and people around the world. Here in the US, health professionals are highly trusted, and not only in general, but they're highly trusted as a source of information about climate change and highly trusted among people across the political continuum. They are one of the very few types of professionals that are trusted, highly trusted among Americans across the political continuum. Moreover, our research has shown that, again, across the political continuum, people say in response to information provided to them by health professionals about the human health relevance of climate change that, wow, that's important information. That's something I didn't know. That helps me understand how this otherwise abstract threat is relevant to me and my family. And it helps to engage people in the issue in a much deeper, a much more personally relevant way.
And if I might just underscore that and tie these two things together again, there are a lot of bad things going on, but the good news is there are a ton of solutions out there, and the solutions, first of all, make great economic sense. So we have solutions for clean energy. We have solutions for microgrids. We have solutions for storage. We have electronic vehicles. We are investing tons of money in increasing tree cover and reducing, the street temperature by having more reflective surfaces. And the critical thing is that all of these climate solutions are good for us. All of these climate solutions are also health solutions. So the answer to the climate change problem is at the same time an answer to increasing rates of chronic diseases and acute diseases. And that's partly why the health professions have such an incredibly important role.
Yeah. Healthier planet, healthier people. I know you were just listing off some of the great things we have going on, but, say you have magic wand. What would be your number one item on your wish list in terms of a policy or action that can really help bring us to the next level in reducing the health impacts of climate change?
The closing words at last year's COP meeting, the global climate negotiations in Dubai, the closing words were essentially, we have seen the beginning of the end of the era of fossil fuels.
COP28 also needed to signal a hard stop to humanity's core climate problem, fossil fuels and their planet-burning pollution.
The leaders of the world have agreed we need to bring the era of fossil fuels to a close. If I could use my magic wand here today, I would accelerate progress on bringing the end of the era of fossil fuel to a close. We can't afford to let that era play out, that closing act of this era to play out over the next 5 or 10 decades. We need to bring the fossil fuel era to a close over the next 2 to 3 decades. So that's the single most important thing that needs to happen. And the more rapidly we bring the era of fossil fuels to a close, the more rapidly human health in every community in America and in every community in the world will become ever so much more robust. So the sooner we take these actions, the sooner human health will benefit.
I'm going to agree, first of all, with Ed that we have to, number one wish list has to be the long term, because if we do not turn the tide on the continuing growth in emissions of greenhouse gases, we are going to suffer. Our health is going to suffer that much more in a very pervasive and profound way. The second thing I'll say is that if we have governments around the world embracing this and doing all that they can to prevent the severity of climate change, that's going to be one of the best things that could happen to the mental health of everybody on the planet. One of the most profound reasons why children and young adults are expressing severe depression and anxiety is inaction. It's not just that the science is bad. It's that the humans who are leading our governments are so often not taking it seriously, so often denying it, so often not taking action as strongly as they can. So that's kind of a 1 and a 1.5, double win on just the primary action. The second thing in the short term is, we have really important programs in this country that are responsible for the resilience and emergency preparedness of our health systems. We have one for hospitals and the healthcare delivery side, the hospital preparedness program. We've got the public health emergency preparedness program. Both of those are being updated to ensure that those resources that are going out to health departments and to health systems are being put towards climate resilience and addressing extreme heat and wildfires and air pollution and floods and hurricanes, et cetera. And those are really, really important changes, but neither of them has been given much more money. And I think that we need to invest. There has to also be an investment in some of the resilience, or it's going to have to be capital improvements and retrofits of facilities to ensure that the backup power systems are in the right place, that critical records and servers and our electronic infrastructure doesn't flood, all of these things. And so an expansion of programs that ensure the resilience of our health system would be the second thing.
Absolutely. Dr. Balbus, I sort of want to get to the second half of your office's title, health equity. We often know that even though we all feel the impacts of climate change, certain communities are more vulnerable or exposed to the worst impacts of pollution and climate change, and they often also feel the health disparities. So I'm wondering, you shared some of the efforts your office is doing to create these partnerships and really draw from resources that different agencies have. But what innovative strategies are you implementing or plan to implement to enhance climate resilience and health equity in vulnerable communities?
So the first thing I would say is, again, the Biden administration deserves enormous credit for the work it has done in environmental justice and its Justice 40 program, which is ensuring, and I've been hearing some presentations in its initial implementation, even exceeding that 40%, ensuring that the actual investment in funds goes into communities that have been historically disadvantaged, disenfranchised. The importance of that cannot be understated. At the same time, none of the funds, from the Inflation Reduction Act or the bipartisan infrastructure law that are going towards climate resilience in communities has gone to HHS. None of it is going to the health sector. So, and our office as well has not received a congressional appropriation. So the remediation of historical disinvestment has to be some kind of investment. It has to be some kind of fixing and financial, financially supported investment. What our office has done has been, as I mentioned, to take advantage of the existing programming. We are the Department of Health and Human Services. The human services side is the safety net for our nation. The Medicaid program is the safety net for low-income families to get their health services. And so we are doing everything we can, working with Medicaid, working with the Administration for Children and Families and the Low-Income Home Energy Assistance Program to ensure that those funds get targeted as best they can. So some of that is making sure that states and localities are just even aware of the flexibilities in Medicaid through those Section 1115 waivers. Some of it is creating our own novel data-based scientific resources, like we just partnered with the CDC to create a new heat health index, which for the first time gets down to the zip code level with heat vulnerability that incorporates actual burden of illness data. That's never been done before. So it's not just that we can say this neighborhood is hot. We can say this neighborhood has a lot more people calling like 911 for heat-related illness down to the zip code level. So it's a combination of giving the agencies the best tools as an office, and doing outreach to state, local, territorial, tribal governments, which actually are the ones with the responsibilities on the ground to make sure that they know of all the flexibilities they have.
One quick follow-up. You mentioned before that your office hasn't received congressional appropriations, but the White House has proposed a $5 million allocation for your office this coming fiscal year. You were just mentioning how it's really important to invest further in this area. So can you share with our listeners the importance of receiving these appropriations and how you would take them to enhance the work that you're doing?
Well, again, $5 million in the scheme of the investments that are being made is very little. So there's our office, but then there's just the investment, first commending the investment that has been made through, the game changer that is the Inflation Reduction Act and the bipartisan infrastructure law,
right,
and the investments that are being made there. For our office, without the big grant programs, without, the big investment that, for example, the EPA has been setting up, we're not trying to duplicate that in any way. We would not be doing that. What expansion for our office would look like would be really building the partnerships with the health sector, and especially getting to the state hospital associations, to the rural hospital associations, and being able to do a better job of connecting the nation's health systems to the resources available to them to make, investments that lower their costs, improve health outcomes, and reduce their pollution footprint. It just feels so important. And, that is what we're trying to do is to scale that up.
If I could add a research overlay onto that, my team right now, we're interviewing policymakers, U.S. federal level policymakers, and people who are attempting to influence federal policy at the intersection of climate and health. We've just completed 65 of those high level interviews, and we're analyzing the data now. One of the things that is clearly coming out of those interviews is the fact that almost to a person, those 65 high-level people feel like, yes, it makes real sense for us at the federal level to be integrating health policy and climate policy. Because as John Balbus was saying earlier, there's all kinds of opportunity to improve health by in ways through measures that also will help to stabilize our climate. But there are really two barriers that have been identified as fundamentally stopping progress at the federal level in the U.S. right now. One is silos, the fact that different federal agencies, they have different mandates, different ways of pursuing their mandates, and there's not necessarily a lot of crosstalk.
Mm.
So that's one problem. And the second problem is there aren't very many people like John who actually have knowledge and expertise in both climate and in human health. And so it's the siloed nature of our federal government and the lack of trained people who know how to work at that intersection that are currently holding back the U.S. federal government response. So those are two really important actionable insights because it suggests, hey, we need a lot more crosstalk between our federal agencies if we're going to do all we can do to protect our climate and protect our health. And we need a whole new type of professional who knows how to knit the activities together, to explain to the health communities the health relevance of climate actions, and to explain to the climate community the climate benefits of the types of things that we need to do at that intersection. So there's a real lot of opportunity, and John's office, OCCHE, is really right at the center of all of that. As he said, it's a new office, so he and his very, very small team are just getting their oars in the water and rowing forward. I personally would like to see that office grow and be resourced more generously because they really are the point of the spear that can help knit these different activities together.
Yeah, I completely agree. I think it's really inspiring and wonderful to see when agencies can come together and bring their unique resources and expertise to, really address cross-sectional challenges that our society faces. I'm hearing a lot about connection, collaboration, cooperation, and Dr. Maibach, you have plenty of expertise in climate change communication. It's part of what, your whole center is about. So I'm wondering if you could share with us some of the most effective methods for raising public awareness about health impacts of climate change. You were mentioning how doctors are trusted community members for folks to get that information, but what other strategies or messages are most effective in motivating people to act or just become informed?
Yeah, the hard reality is that climate change is complicated, and the health impacts of climate change are also complicated, but the human mind doesn't deal well with complexity. The human mind, we're awash in information. If we spent too much of our energy trying to understand all that information, we'd be taking our eye off of all kinds of other things that we need to pay attention to just to make it through the day. So from a communication perspective, we have no choice but to take that complexity and find ways of making it simple. Find ways of showing people the most important things that they need to understand about climate change or about the human health relevance of climate change. So from my perspective, having worked as a public health communication professional for the past many number of years, I won't give you a number, what I've learned is that to be effective, you need to have simple, clear messages. You need to take that complexity in the world and render it simple for people in the form of simple, clear messages. You need to have those messages repeated often because it takes quite a few repetitions. It takes hearing the information quite a few times before people can begin to process it and integrate it into their thinking. And then you also need that information to be brought forward into the public conversation by trusted and caring messengers. The reason why health professionals have that necessary and unique opportunity that I talked about before is because they are trusted. So when the messengers aren't seen as trusted and caring, people reject the information. Health professionals, fortunately, are trusted. They are understood to be caring. That's why they're in the health professions. So our opportunity to help America move forward in rising to the challenge of climate change, that opportunity is going to be enhanced to the extent that our nation's health professionals use their trusted voices to find ways of explaining the human health harms being caused by the fossil fuel economy and by the climate change that it's causing. And also to reveal the fact that, as John said earlier, that climate solutions are also health solutions. And they're health solutions that begin to pay off immediately and in the communities that take the action. Unlike climate solutions, which tend to pay off over many decades and a little bit around the world, the health benefits of climate solutions pay off immediately for the communities that are taking action. For example, if we clean up our fuel supplies in our community, overnight we get cleaner air and cleaner water and better health. So it's this extraordinary opportunity that the health professions have to help bring America forward by sharing what they know, frankly, by calling out the people who are standing in the way of climate action. We've done research. Health professionals aren't necessarily comfortable calling out the opponents to health action and to climate action. But we know from our research that when health professionals call out fossil fuel CEOs and their lobbyists and the politicians who are in their back pockets, that it's helpful for people, because it helps people understand the reason why we're not moving forward as quickly as we can isn't because it's hard. It's because there are some people and some vested financial interests in the form of fossil fuel companies who are doing everything they can to stop progress.
Very true. So I want to look forward a bit. From each of your own organizations, are there any projects or initiatives we should be on the lookout for? Or, what are some of the perhaps longer term visions that you see your organizations playing in the continuing cross-sectional fight against climate change and for health promotion?
So our office is very busy, and we have quite a bit that is slated. I won't go through the full list, but we will be releasing a brand new revision to a very comprehensive toolkit for health system resilience. We're releasing an internal training module to train all. Ed was saying we need more people, with basic knowledge in this area. So we're starting at the ground zero with a training module for HHS staff. But what I think is most important is, as an office and as director of the office, I am firmly committed to transparency and accountability. And it's not always seen in the federal government that targets are set and that quantitative information on how well we're doing is put out there. Our office will be releasing a set of indicators that I hope will persist over the long term, talking about the long term, and allow us to really see the trends in these things that I'm talking about. So part of this will be a comprehensive suite of indicators to help really look at heat. So not just looking at the health impacts of heat, but also looking at the exposures, looking at the heat plans, looking at the resilience measures, looking at population vulnerability. Same thing for wildfires. But then for the first time, we're going to be releasing information about what is going on in terms of the health sector reporting their greenhouse gas emissions. And that doesn't exist anywhere right now in the federal government. And also metrics of health system resilience as well. And then starting to set goals. So starting to set goals for the country for climate-related health impacts. So watch this space. There's a lot to happen in the next few months.
That's great. Governments and policymakers in a democratic society can't get too far out ahead of the public, because ultimately they hold their jobs because we elect them to represent us as our government officials. So it's incredibly important for government officials to understand when and in what ways the public supports action, climate action in this case. So I'll say that my concluding thought is I'm extremely enthusiastic about a project that we are now just getting off the ground with Forest Marsh, a survey project. We call it CRISP, the Climate Resilience Insight Survey Project. And the whole purpose of this project is to collect public opinion data in communities around the country so that the government agencies that serve those people will have a sense of what they would like to see done to improve the policies and improve the services in their community that will make their community more resilient to the impacts of climate change. So, think about all of the different federal agencies and all of the money they're investing in trying to make America a more climate-ready nation. Right now, they're largely flying blind. They don't have a lot of input from residents of communities across America as to what kinds of responses they would like to see implemented. So this Climate Resilience Insight Project is all about collecting that information so that there's more of a dialogue between the governed and the governors, if you will, people who serve our government, and we elect them to do so, and the types of activities we would like to see them pursue on our behalf. So that is a project to soon be released. I think it's going to be incredibly helpful to our federal agencies, to state governments, as well as to local governments around the nation.
And I'm just going to throw in one more thing. The other sign of progress for this issue is when we see the other parts of HHS really taking definitive action. And some of these agencies, it takes a little bit of time, but one other thing to keep an eye out for, the Center for Medicaid and Medicare Innovation, CMMI, released a notice of proposed rulemaking previously in which they announced that something called the TEAM model would have a voluntary component for having the health systems in the model report on decarbonization and resilience measures. This is, it's voluntary, it's within a model, but for CMS to have this issue written into the rules, so to speak, is a huge first step. And so keep an eye out as the rules start coming out from CMS to see that the issues that we are talking about today, the issues that have to be addressed by the health system, are starting to become integrated into that process. That is the change that we really need to see.
There's so much that, we can look forward to in the near and long-term future. And thank you for shouting out our partnership with you, Dr. Maibach. I just wanted to say, if there was just a quick piece of advice that you want to give to other organizations, healthcare professionals, the very folks who need to get engaged, who want to make effective partnerships in addressing climate change, what's your quick message to them?
Lead from the front. Do what needs to be done in your own organization, because that will make you that much more of a powerful force for good in the work you're doing outside of your organization.
And I'll just double down on that with tap into the energy, the passion of your own people, especially the young people in your organization. We see this time and again in health systems, that there is just such a resource within of the nurses, of the staff within the hospital, especially the younger staff, wanting to see the organization move in this direction. They're a huge resource.
Thank you both so much, and so much for your insight and for sharing your work today. I know that, like I said before, summer is especially a time when people are thinking both about climate and their health amid the heat. So this has been such a timely conversation, and it's been even better to hear about the efforts you've both been making to address both. Thank you, listeners, for tuning in to today's important conversation around climate and health. If you're interested in learning more about OCCHE and the Mason 4C, we'll link to more details about them in the show notes. The summer's still hot and the climate's still on our minds, so if you enjoyed today's conversation, you'll be happy to hear that we'll be back next month with another climate-driven conversation with the Environmental Protection Agency. We'll be joined by Vicky Arroyo, who serves as the Associate Administrator for the EPA's Office of Policy. We'll get into climate adaptation, resilience, and her history working in environmental justice. I hope you'll come back for this awesome conversation, and in the meantime, make sure to subscribe, follow, and share the show with a friend. Also, don't forget to rate us on your podcast platform of choice. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries. If you want to know more about today's guest, are interested in participating with Forrest Marsh, or becoming part of our community, check out our show notes for more information.